Now we're going to turn to the John Dirks Canada Gairdner Global Health Award. And this has become really one of the most renowned prizes around the world, recognizing research with major impact on health in the developing world. And the prize was really the vision of our President Emeritus, John Dirks. This year's awardee is Dr. André Briend. And Dr. Briend is a former senior scientist at the Institut de Recherche pour le Développement, adjunct professor at Tom Perry Center for Child, Adolescent and Maternal Health Research at the University of Tom Perry, and an affiliated professor at the Department of Nutrition, Exercise and Sports, the Faculty of Science at the University of Copenhagen. And he's been awarded for the invention of ready-to-use therapeutic food, which has truly revolutionized the management of severe acute malnutrition in children, allowing treatment to shift from inpatient care, where very few children could be treated, to community-based management and saving countless lives. So Dr. Briend has chosen a rendition of Jarabi by Senegalese musicians Toumani Diabaté and Sidiki Diabaté. Dr. Briend chose this music to refer to his years in Senegal and to honor his colleagues who were involved in the early RUTF trials.
Thank you. I am deeply honored to receive the prestigious John Dirks Canada Gairdner Global Health Award. This is a recognition of more than 3 decades of work dedicated to improving the treatment of severely acutely malnourished children. This effort has transformed and often saved lives of literally millions of children around the world. This achievement would not have been possible without the contribution of many other physicians and scientists. In the beginning, only a few of us believed it was possible to treat malnourished children in their home using a solid therapeutic food. The first time we met, we could all fit into a small room in a rural health post in Malawi. Soon, however, tens, then hundreds of scientists, physicians, and community health workers joined us, enthusiastic about this new approach to treat malnourished children. I want all of them to be associated with this honor. Today, community-based management of severe acute malnutrition is recommended by the World Health Organization and implemented at scale by UNICEF. Ready-to-use therapeutic food are included in the WHO model list of essential medicine. It is almost hard to believe now that this approach is widely accepted, how much resistance we faced when we first proposed feeding malnourished children at home with a solid food. Yet today, we face other daunting challenges. Many programs that treat severely malnourished children are threatened by cuts in international aid. These reductions are likely to cause a tragic increase in preventable death among vulnerable children. At the same time, the lack of global commitment to reducing greenhouse gas emissions is putting us at risk of major food crisis in the years ahead. This is a moment when effort to eliminate severe malnutrition should be strengthened, not scaled back. I would like also to take this opportunity of this award to thank my beloved wife, Chantal, who has been support for nearly 50 years. I want also to thank, our wonderful children, who are among the first in the world to test ready-to-use therapeutic food. From the start, they told me it tasted very good and that it would work. So they were better than the best experts of the time. Finally, I wish to thank the Gairdner Foundation and especially Professor John Dirks, where is he? For establishing this award for global health research. This honor is a tribute to all those working in this field who so often receive little recognition for their vital contribution. Thank you for your attention.